Today na the 29th day of December 2020. 2 more days to go. We go say welcome 2021. One more day for make you submit you 1 minute video and tell we wetin you want for see na Salon 2021. Wetin you dey wish for see na Salon 2021. The numbers the more we can announce now, yeah. Now they send you 1 minute video. Like I said, if now one person send video, now one person you will see. And now tomorrow, by the time we the end tomorrow program, everybody in video for don't come in. And if your video not come in, you will not be featured. Because we they take the 31st. Now we go set the video duam over duam so that on the 1st of January 2021 we go upload the video. The numbers that we can announce now, yeah? Send you 1 minute video how you want for see Salon come 2021. Today we want learn a table the healthcare system na Salon inside 2020. We want for listen from the Minister of Health and Sanitation. Make we hear from him. Because when this COVID be happen, a lot of people can ask, where? Then I can tell we say, lowly looking at the launching the number can did. But today, I want for make we know the gains where the government make and waiting at the challenges them and how the government don't fit for put then put tranga one so that we go get a better healthcare system na Sierra Leone. And most of we within a year we know say that in one of the things that we can always talk about the healthcare system. So for today we go deal with the healthcare system, and for tomorrow we go come for can a table all waiting we think say the government achieve inside 2020 and waiting we want for remind them come 2021 where them be tell we say them go do but we they not be able for do. Now we go do tomorrow. Okay. But before we can talk about the healthcare system, make we just look the status updates for COVID-19 na Salon for today. The labs they analyze 1,051 tests. Yes, you already know say yanda na the flights the way they go. But some 1,051 tests na in the labs them analyzed. Out of that 1,051 day, 9 turn out for be positive. And the 9 na so them be look like. From Western area urban na 7 9 come out today. From Western area rural 1 9 come out today. And from the diaspora inbound passengers now 1 person. So now the inbound passengers they don't get a total number of 53. 53 confirmed cases them from the inbound passengers them. Now we don't get now na Salon. So because of the 9 way we get today, the cumulative confirmed positive cases now don't reach 2,569. For the past 24 hours, nobody not lost in life to COVID-19, so we still stand at 76. The one that in isolation center, now 618. For the past 24 hours, 3 people now they recover from COVID-19. So because of that, we don't get a total number of 1,875. The one that more in quarantine now 280. The one that more on discharge from quarantine now 12,415. So now so the numbers them look like for today, but make we check the Mano River Union countries them. For today, Salon 9, Guinea 14, Liberia na 0. Liberia 0. And they tell you, Liberia, then they do fantastically well. Yeah. But again, I want to see how many people then they test for day. Ivory Coast, 24. So for today, we get 47 new cases. The cumulative death, one don't add from Ivory Coast. Sierra Leone, 76. Guinea, 80. Liberia, 83. And Ivory Coast, 137. Ivory Coast, I don't know. Now, 2 people I don't add this so for the past 24 hours. 2 people. So a total of 376 people. Now them we don't lost. Now the Mano River Union countries them to COVID-19. Now to a program proper. Sierra Leone healthcare system in 2020. A lot of we that other time where we be say for make we do a video and just send a message to the president. I think everybody on that video says something about the healthcare system in Salone. So it go just fine for make we able for listen from the minister himself how we feel say the healthcare system they perform inside 2020. Salone government, according to the minister, because I see Michael Cook herself say it look odd to him. He say Salone government give UNICEF $6 million for help for buy equipment them. Okay. Let we all land there. Let us not talk. Let us just listen to how the minister they give you report card for 2020. Okay? Sierra Leone healthcare system in 2020 according to the Minister of Health and Sanitation. Let us listen.
This year started off with something where nobody else no go one for me happen, and that is we get the corona pandemic. So it started off by us addressing that. You know, this country been longer exposed to Ebola 2014, 2016. Well, we were able to keep all the structures intact such that our preparedness being very good, very good. And with the addition of the political will, the political drive by His Excellency the President, you know, say in West Africa, require molecular biology more we're able to do in country. This is the major. This country till 9 months don't pass. Last country will get corona March 31. Apart from that, we are able to put in place all the pillars them where you require for address this thing. So for example, all the tests them we require molecular biology more we're able to do in country. This is the major. This country till 9 months don't pass. So almost the end of the year with the car. We've only had 2,500 the case system. We tell you, see, with surveillance been good, with contact tracing been very good, and we've got about 80% survival rate. We tell you, see, back the case management and doctor they do very, very well. The nurse them help we tremendously. So as a country, the very first thing first, and we make you proud. Say why is other countries they want to they can learn me, they want to they can teach me, they want to can show it in a public health. They are still struggling. Sierra Leone has been able to manage it and manage it quite well. We should not be compliant. We should not be complicit. And therefore now we boku brother and sister then they come into the country for can see them family. We have to be a bit more stringent now. It's not surprising me if we get for come back for make we say we for check you as you come and you for the on quarantine until the results show negative before you come or go join you people. And we self plan this enjoyment time. We get for enjoy responsibly. This is a time where we for demonstrate say we are a country of responsible people. So the ministry has done very well with regards to upkeeping the safety of everybody from a public health intervention. The ministry also recognized that one ailment with the money pass any other thing, now malaria. And the ministry go out for them, they distribute 4 million malaria bed nets. That is a major gain. So you know, see boku ailments them now the country now.
Professor, you don't about anything in the more we look at the nurse system, the doctors, and the well body workman them. So how una be able for recruit, una be able for get more people into the hospitals?
Well, everything in this world, machine or building or if you don't get the motorman, you don't get nothing. So the motorman in skill, na the first step. The motorman also for make you feel better, make you feel good, make you enjoy where you go is the next step. Remember, last year, what did we do? We give 3 allowances: on-call allowance, biohazard allowance, and location allowance. Those allowances were like your take-home salary. In other words, we gave 100% more to the health sector. That creates a settling effect. Then we set out to employ 4,000 people since 2018. We don't do so now. This employment we do by district, such that with every district we do now gets some level of staff we they need. When you don't do that balancing with regards to staff, the other thing we do for help now for improve the ambulance service. So when you're sick, they're able to pick you, can you go to the hospital fast. So you see, this time we were able to address quite a large number of people. The last bit is drugs. Every quarter you go see names, the NEMSA, the one the way they move drugs. Every quarter you go see who they carry drugs. As far as Kamakue, Pujamu, every corner, Falaba, we get drugs and distributed. The terrible thing, however, I say terrible, then drug under frail care, we are supposed to be for pregnant women, lactating mothers, and under 5. We expand them for making include disadvantaged. Possible we don't get corona, possible we don't get Ebola, disadvantaged. But now every big man and big woman upline, we sick them on the same drug they 9 day and they give them. Such that they get stuck out. We get stuck out, not because we don't supply, but we don't give people and now we not that we be planned for give.
Today I've been fortunate to attend one of our programs. We say you be the talk about Connaught Hospital and other hospital. They change into tertiary hospital. So how far when I be don't go down?
Well, on paper, I put on 6 hospitals in this country we're not tertiary hospital. However, the service where they give now, reach the level where they for. Now I make but who see people who get for the send and go abroad. Too easy. 1, will not get the right skill mix of personnel. 2, will not get the right equipment. So it means we get for address, then 2 years together. If you look, group me come, Mami and Peking Foundation, who have done the cooks and they work with, we don't can say, hey, they don't get $3.8 million. Where they want for me to train 50 ups and downs people, 50 pediatricians in Sierra Leone. The same way, the Ministry of Finance don't give some money to the postgraduate University of Sierra Leone teaching hospital complex. So we begin training people in Naya. If we not train the people in Naya, electro to do will not go for do all the elements. That's one. But if you don't train them, you don't get the right equipment back, you are in trouble. So this time, rather than we go on tender, we give about $6 million to UNICEF for buy $6 million, not to Leone at the Toko, for men who can buy for we the right equipment there.
We give $6 million to UNICEF, not to Leone, so dollars for make waiting, then can help we buy equipment them where we go need. And so the minister say. We want to say thanks to Radio Democracy, because not through them make me and you able for listen. $6 million. So maybe the cry don't they cry now. Sometimes the answer don't they cancel small for buy equipment. And which kind of buy equipment then? We don't know it. But maybe now that equipment them way they talk say we not get way make them they fly people them out of Sierra Leone. We then come with them. Which hospital then they want put them? We know all them questions and they we not get answer to it. But some of the things that we say we need for be proud of the way how we healthcare workers them handle COVID-19. He say that because of that day, now make we get just few people them where we lost to COVID-19, and also we recover it they right up there. Say now because of the way how we structures them all put in place. Now make. He say but for now, the need for put strange measures. Because of waiting, because of who the community diaspora go salon. You side talk say then for begin quarantine. I don't know if you hear that side. We begin quarantine the one that would come on now in the diaspora. Why they not start and yet? I don't know. Because remember, say before, when they do that, and they all need to go come out. When they do that, so you can't quarantine me, you not get to forgive me for it and all. We know all the backlash will come with the quarantine. Because money gets for go. And it look like say something, money no one for be spent on quarantine anymore. But until say, then they look into that, we go see. Then they also tell you about malaria. Say them be distribute up to 4 million malaria bed nets them across the country and be distribute them. Where people them for they use the net so that you go able for help them. He said the free healthcare drugs and be for them picking them. But then come out and say, okay, well, make them come with vulnerable people them. And they want the way be done like the Ebola survivors, them, the survivors them from this corona. But I say right now, most people them. Now the provinces now they use as example because for inside Freetown, you not go use and safe. You not go use Freetown safe because we all know say Freetown all ten get complain. Eh? All 10 Freetown get complaints, so you're not going to use Freetown at all. But, Nayana Salon. The minister don't get a report card. I don't know if you what do you take? But now the healthcare system we they talk about. $6 million don't go to UNICEF for help we for buy equipment that we will need. He said now we give UNICEF. So who they expect from UNICEF now? Self don't begin give UNICEF for help we for buy. Well, and they want that. But make cook out us friend. Make we hear waiting and get for we for today. Yes, us friend, you get the platform, sir.
Yeah, thank you very much, Triple A, for giving the platform. And thanks to all the listeners and viewers here. Issue of the health in terms of the healthcare system, looking at it from 2020, we'll say in some way, looking at waiting in the minister directly, they say that there are areas that we actually bring in inputs. But the question back you go ask on the other side, if this is relatively enough or we are trying to develop for we try to reach the stage because all we don't know say thing we don't point. And things may find at some point that because of population, because of economic growth, and because of lack of economic growth, and because of the growth of the population, and because of many reasons then, and then we get lack of maintenance, so some of the things and dilapidate, and so they're not able to accommodate outside people they need for day in terms of say inpatients. Lot talk of the number of staffs. We talk of the number of hospitals, and then you look at the number of the people relative to the healthcare workers. So in other words, we need a doctor with relative to the number of people that we forget because in a kind of a ratio, so that they go evenly there. So these are the areas that now we get for question. But in terms of areas that they don't bring, can they bring? Because there is first of all the drug issue I want for say. Now the area we will talk about and then bring a quarterly drug a free drug program. So this quarterly, I think they decide to bring them in different halves in the year. The other half, they may just not bring a research. But these are drugs that would exist specifically we go for lactating mothers, and then behind the way now postnatal, antenatal. In other words, woman who don't born, we not born it. So all those areas them, or like few or headache medicine, and then even some few treatments way in terms of malaria. like the very treatment where they don't bring with a new one, or they don't use chloroquine again, and then they back them up with nets for prevent the malaria. All right, so these are things that we will see and then bring them inside. But the area of the drugs, the question is back, well, as they are trying and they're doing their very best, you will ask again, the drugs, not to every drugs will actually be inside. That component of drugs that wouldn't be given are free. And certain individuals, they will vulnerable and women them and picking them. And then also they descend to the provinces. But not to all treatments that will they treat like serious them, they not actually get inside the medicine that they give. Some of them are limited with the day, but some of them they not at all inside this package where they go and give. So that's why you go say, well, then there is need for them to help more. Because when you see another program I've been listening once and they try to discuss about the medication, we expect the government for try wipe out the taxation of the importing of them drugs there. It affect the price of a market. It affects back. Then when they try for order for make them, he said they don't actually try their best for cut down the taxation on the malaria treatment. Now the person will represent that area that by then on the mainstream media. So he talks saying that the only drugs and they will few like paracetamol and few drugs, but the other drugs then when actually some certain diseases are specific, like kidney disease or other fasting that when are very acute disease that would affect somebody in body. He said that one and they still the tax is still the apparently. He said if they beg the government, let them will try, let them will reduce the taxation on their drugs they are. So the only one way if they say the government don't do well, that the taxation on the so-called the malaria treatments, because now UNICEF we don't actually bring this together with some other organization for letting go give some mosquito nets and together with the malaria treatment where you get free in any center where you go, whether a big person or small person. So that one they even did. But again, you could go ask again, say during this audit, the drugs them where they keep, the storage is very poor. Then I want thing where they be identified and then get drugs and way now out of date drugs where they put together with the one that we still then they use. So he even did the auditor general, very difficult. So the auditor general, it be actually question the value. But because the value of the one that we did out of date and the one that we actually present been difficult to get the value. So he advised them for them to try do better storage system. And he look back and go see beside the way next they will be the key Africa. Then we stop the program where this Ebola come. So then that was spread them back in between. So then they are the balance, they don't go keep them aside, where some of them then they really look out of good quality. So those are the areas now where they say for try look to in terms of better storage and medication, how they were able to store them and make it go able to reach people, and the taxation area they get for review for some of them drugs there, and then they get for look into the pharmaceutical area where people then tend to the peddler and streets who start drugs when they use and as in they do now. Then another side for the drugs. And then when you come out the other area actually where even try for emphasize more because our area are different mainstream media, but the 198.1 voice, the other side where you appear actually, if they try for still repeat like say that the same trend for say yes, they actually don't do well. And we all know when they talk at this time of the world, this time now, when the world is so, the first way every health sector they address that the issue of the pandemic. All right, but it just do scanty in other areas. But the point where he bring Yana back, he try for talk say they don't do very well for curtail the sick, and they don't get the manpower would be able to do them. And then secondly, under the administration of the president, they're able to get the test. But some side will be look complicated. We be try for say about this molecular biology. What do you mean? Now just how they try for check about how then the very virus itself, because nucleic acid. That was not something they study, but the small to them, how the tumor they live with the other thing in the body, when they build your body. So the thing that when they build the body for make like your body tin up well, now with the tumor that when they can inside the land, they try to talk about for say molecular biology than the virus itself. But the idea is what we know say 2014 and 2016, they been get problem for letting go they test the Ebola virus at the beginning. But now, if you mention in one of the podium, I don't know if it mistake or it mean, but I feel saying that it be actually right for say in terms of more of good thing what they don't do for say now they don't able to forget that one day in place. But again, it mentions say they not being get out of Ebola, but it not mention when they get the machine there. The only thing when I just say that time they would Ebola been they will not be able to take the virus test there, pass will they send there abroad. But now under the leadership of the president, I quote what he say, not even put a gap between, but under the leadership of Malaria, then they able to do it now. But again, you can sometimes they give the information to people who they know they try for getting the right thing. The point one is right for clear now. During the time of the Ebola, now only 2014, towards the end of 2014 and 15, then we don't give tuberculosis, leprosy and tuberculosis program, then we go give them PCR there. Now then we don't bring the machine there. But by then, it's in a be rush and be able to implement about 3. I think that one at Laka area and the other 2 there, I think somewhere around the city. And then no, Kenema, sorry, the second one, Kenema, because Kenema began the first one at the province. So and then the other one the 2 then are Freetown. But what I did for seeing I say now that 10 days they bring that in there. They will self then begin to test people and they come up from Ivory Coast, I mean from Liberia and so on and neighboring country for can't test the wildness sense. Congo they say get them few countries in West Africa been get. But we have been the first people who been get the PCR when they use so today. So in other words, there is another a structural a basement will be done there now. In other words, when I say we say long-lasting developmental program, we don't day. When somebody we don't implement her, and then the only thing that will be done left now for letting go put more of the tests there for day. But what I like for seeing now, the message sometimes, if you don't understand, they go confuse, say, oh well, they don't do good, they don't do this. I am not saying they've not done well, but I'm just saying for let the people and go know because that's like history will possible know this year now that this will get the PCR. Now for the reason this will get the PCR, now so people that we don't do. So all those kinds of things they get for them. But actually, because of that foundation, they will be done there. So obviously, Salon be able to go be ahead for first the thing. And then the areas they don't wouldn't do, they're able to deploy, which is very good. And deploy people at the boundaries, at the airport, they begin to stop people for quarantine. I don't know if that one day it mean doing that same day for seeing I make them succeed. I mean, for that, if they for explain it, because then they keep people up on that quarantine, then I mean reduce the spread of the disease. But again, if you ask yourself, say, well, that was very good with everything don't do. But the problem is people who they do this service. They say the service of people that they do, some of them they get risk allowance and they get this. But you go ask say the ones that what they need, what been doing at the ground, were they having the right pay up to now? Or not just the one day who been there just choose themselves for get certain pay and the others they not get pay. So you go question them based on the audit will all come. An example I go give now way in terms of when they try for toxic, they don't add payments, which is very good because they increase the number of staff of the nurses system. Some of them don't get PIN code. But the point is that there are students that want to be done study on the United Nations Development Program where they go train their anesthetic and narcotic. So they're not trained, they come back. But some of them were not actually done the SRN, where that's state registered nursing. They may do SCCH, but they manage good one. But because they want for further education, so they go get more power, they say, okay, let them go do the SRN course. So then they do, finally they do, so they do the SRN course. This SRN course, then they do it now in the form of a leave, because they will not employ them by then. When they don't come out, they employ them at the hospital, then they work at the theater. But because of some of them, they're not being get SRN, but they know what they do. It's okay, well, for let you go get more backing, so go try to do the SRN. But here is what they call secondment in certain place. I don't know what is the administrative day. So that people there, then they on leave, then they study. But sometimes they can go do job. So there is a time when they decide for giving their salary, they may just say, okay, well, they go give one a kind of study allowance. Okay, the driving, they're not being the parents. So they say, well, let them apply. They go ahead, they apply to the ministry, they give them this money when they study allowance. So time go on now, then they write to the matron, cannot say now, the people that will not need this money, they're not entitled to lecture.
So in other words, with the parents still, I mean, they're not supposed to get a leave allowance. So therefore, take them back from the money what they pay them, because then they actually work as an aesthetist in the theater. So because again in the study, that leave what they give them, they try to give them what's that leave allowance. So now what they do, because they don't begin paying them back their normal salary, that money where they're entitled to, they don't put pressure upon the matron and connot for letting the cut, and then the cut are now back at their salary. So instead of them having more, they are having less, equivalent to 2-3 months back when they don't give them. They take that 3 months and they pull them back. So what are they trying for saying now? There are things where the people and therefore come to the ground, then they see what's in the happen. Then I'm able to ask how the people and they feel. Would increase the number, because increase the level of education, but the people already get a better service. So all these kind of things that you go try for questions, say, are we really sending the money to the people that we need for get them? In terms of what they do, they are trying, as I've been saying before, because in a place, in a thing what we don't break down. We all don't know about development, but sometimes you go think, say, when we do development, are we taking it in a way where it will benefit both the citizen and the one they want to care as them for them to look after the citizens? Because the NGOs, together with the MDs and the workshop, the NGOs then they bring the help. Then the UNICEF then now they can act as a barrier, I mean a kind of procurement thing. Well, we don't know in terms of what they get because they are experts in many things. But these are United Nations International Children's Economic Fund. So I don't know, I'm not saying they're not expertise, but I don't know the expertise if not the area of the children or the maternity that they do. But so far so good. There is actually improvement, but we not know no more now the type of improvements will they come if you go get for reflect immediately to the poor man and to the one they want the people that we concern. And the tertiary hospital where they try to talk about in primary healthcare, just to clear it, primary healthcare are the one that are the community. Tertiary now the big one they also actually the go, they will forgive you all the treatment you need. But the point here is that if you don't give the information back to the journalist for say now tertiary we can't make this based on what they tell and I think that back it go. All they try for say no, if I don't say we either they try for can develop them or we they try for expand them and put waiting the thing need for be capacited with. Because when would they be in the hospital, we get for make sure say everything where people then get it needed. Because when you look like a dynamite, not just cut a shot now to go, a dynamite, when they a machine that will be saying when you get and then they take your blood pressure, they take your oxygen saturation, like our doctor they say, and then they take your temperature. Okay, these kind of things there now, if you look at the price of it for one, it costs not more too much of £100, it costs less than that. And when you go buy in wholesale, it's less than that. Then you go think, say, these are the things where they say, okay, each word will get 1 or 2. Each word will get 1 and 2. Not so like when word 4 get for leader, then go take up now word 10 or not. Or word 10 for you, take and they get them. And then the building itself is structured to meet with the demand of a healthcare structure. Another one they have been saying that they discuss now for trying help. Wherein most of these structures that they are building are going to be built with advice of technology, so that tomorrow we're not going to build her, they can't say that they broke your back, for them to put oxygen pipe for the patients, or for them to get ward, one isolated ward, or one negative pressure or positive pressure. They are doing all this based on technology. So that they think they are number one, then go they look in terms of development. But in terms of bringing things, they bring it, but with the question, is it reflecting? Or is somewhere money they go? In terms of procurement, or are the people being paid when they need to be paid, or are they having the right drugs, or are they being monitored, or are they having the right treatment? Because say the mayor don't bring them people there now to that well body business, because these are NGOs. So NGOs are helping the government with something directly. Are they going to help to pay those people then? Because the contract is the government is train those doctors, pediatricians, midwives, and other things for that help through the help of the mayor or some other organization. So when they train them, for like they will get what they call a brain drain. For like people who come out to go other side, like how the UK do so, people they come out and they go Australia because of the way they pay the nurses there. But what I try to say is that that is the area now where they try to look at. So they go pay them and they will go work in a private or he go open clinic, he make a doctor, or he go do others country work, he left the country. So those are the areas that I want the platform think of. And thank you very much for giving the platform.
Thank you very much, Uswend.
You're most welcome, sir.
Yeah. All the way from Freetown, Sierra Leone, we get with doctor in the house. We just hope say we'll get a smooth sail to the end. Yes, Dr. Isatukake Jallo, you get a platform.
Hi, good evening, everyone. Good morning for we in our salon. The time don't change. I hope so everybody to do well, and thanks to everyone for them prayer and best wishes that make it safe in our salon. And thanks to Fred for your submission. And because of the network, we will try to make me very short. Based on within the ministry, Dr. Uri, I really talk about, the distribution of bed nets, for fight malaria. Definitely now a good thing for the country, for put measures in place where we say they don't do for some time now. I'm sure they can get then donations also from the help of different organizations around the globe, given that they know say, malaria and something where really they hit Africa very hard. And then when they provide medications to people them really for free for really fight malaria and a good thing too, because not everybody will afford them. As we know say it can really be deadly to many people them, but I think people that we don't live now, where they live salon, no, it's a little bit custom to them, but I think the main thing here, if we talk about how to fight malaria really on sanitation, right? We therefore really find a way in making sure that the gutters then clean, the water then clean, also, people then for use other measures then we will try for fight malaria. But if we can able clean the place, the community then where they live, we can able really able for fight malaria, because from them mosquito then contaminated mosquitoes then feed them bet you. We don't cover this topic before now the program during the health talk, some of the things that we can lead to malaria, within malaria can lead to we go down chronic in body, because it go there within your system for a very long time. And people that we don't sick with malaria will tell you really how then they feel, and it can mimic other signs and symptoms when are the typhoid and all these other different, immune disorders them way, people that not like on time for no say yes, I for go take treatments. And me self way I travel now, so I take a weekly treatment when I the mefloquine 250 milligrams every week, once a week. So really way they do for people that we get for travel this holiday season, and anytime we they travel in general. It will be very nice for like you see your doctor before you left, for like them will give you treatments, where you go take. I know some people can take a daily one, but like the once weekly will be very helpful, as long as I don't do blood tests for make sure say your liver function, you're okay. You could take that the once a week, go forget, and then especially the people where they come, I think it can hit them very hard, compared to somebody we don't live now, anybody don't used to that, and every support where they can at the nation for improved salon healthcare, we really look forward to that. I believe say that one day it will help with country for the government focus on healthcare. I'm sure I also hear with the ministry, Dr. really talk about $6 million, dollars, I believe, if I'm not mistaken with the numbers here, for find ways and how they will buy equipment for help, improve the system. That could be very good. Like that in the beginning, they focus on things that will help with healthcare system. For understand, say the priority now somebody in healthcare, we come to all the other things that we don't talk about when our attack, when our lights, then along with sanitation and healthcare, I think salon will go before. Are they are right now, to tell you the truth, some of the things that we talk about, it's like at the moment you hit here, you go for face down there. The face down, like they go, they come. And then, and not only that, the water issue, no problem. So it's very difficult for like people in Ghana salon, for like them really live the same way with them they live. But now we always talk about getting that enabling environment for people them, for encourage you for like Ghana salon. But we thank God, not to everybody back, we can spend all this time now and go through all that and encourage them for like come back, so I believe saying that something we governments for improve on, and also we really hope say when they don't start so with this, then we'll really make it's very important that the Peking and the pediatricians, they're well trained in how they will tackle some of the illnesses in the country. Cottage, let them really look into it and how they will improve cottage. We get for fine time, really for visiting hospital, and they Sarah Network, charity, one visit and see waiting at some of the constraints and what they face. So we get so many things that we want to do on ground. We hope say we can start for do some of them and then starting next week. But I just feel I'll be one join everybody today and see, I hope everybody do well, everybody for really gear up for the COVID-19 vaccine. I take me on to tell you the truth. Beside that soreness what I feel for the first day, I not feel any other symptoms. So I feel say the first dose they protect you for about 53%. And I make me feel say I be need for take and when I return back, I will get the second one, inshallah. That's not my plan, and I hope say anyone we don't get, I'm sure they will see a similar side effect with you, and that's for encourage everybody for letting go with the vaccine, going forward. The only one thing though, I know say we don't talk about this now, the platform. I'm sure maybe Lord just take and say every time they talk now that Sarah Network. I think say then they listen to we, then they hear we, then we concerns and then they take them very seriously. Even if they're not start for enforce on something, they don't make up their mind, say, you know what, I think them people are right. Mika will be talk about the passport and everything. For me, I'm okay. I know Triple B asked me, I tell her I get both my passport. I not encounter any issues at the airport. We get for deal with them kind of thing. And the only process where I feel say it be a little bit long, which I'm sure they will improve on, because I think I even spoke to somebody within at the lab testing area. I say, the process too long. From the time where you take your luggage, till you go outside, it take you more than 2 hours. First, some of them things that are then questionnaires that we don't do online. And then when they come back, we get to go through that, the line so long, and then, that social distancing, we talk about not sit down in at the airport, and then even at the plane, social distancing is not there. Maybe you go get down there from America, the first flight all the way to Europe. We get from there, now so now choke up. On the plane, everybody, there's no space in between. So this is very scary. So if you get for travel, make sure say you get your mask on, put some gears, really protect yourself so that, it's safe for you, and constantly don't forget for the wasian, and in every way come, I have to tell you, people don't wear masks, like even my own people, they don't wear masks. When I talk, they are still in denial, as if COVID-19 is not real. It is real, but they don't see it like the way we see it overseas. Look how many people that we don't die. So these are some of the things them really it's tough. And, like I believe say, with the testing for the COVID-19 at the airport, then cable improve on that. The wait time, the space, really, if you talk about fighting COVID-19, if you put measures then in place where we say the testing for the go on so rapidly, in the sense that people are not going to wait for so long. Yes, you get to wait for the 15 minutes, forget you result, for that rapid testing, and then the PCR, if you get a text message within 24 to 72 hours, which I'm still waiting for my own. But that's not the concern. I think the concern is not the way people and they wait, and the distance and then time they get for go like 2 different places them, before you even go to the lab, and you get for go begin to answer some questions that way I feel so they can put all this online and let make an easier, you print you give the people them for let them deal with it. So now that no more I feel say I experienced, and I hope say with the malaria side we will continue with the sanitation. I not go in town yet, so I not really know how the city look like. I've only traveled up to Poti from the Tewa Komo Abadin Kana mi location Usade. That's all I get for say. I hope everybody stays safe.
You just want to confirm to we say they not take your passport, right?
No, they not take my passport.
Because I don't but I see a lot of people they ask that same question they back today, even though you don't talk and say they not take the passport, which is good. And also the light business society, how you see that one day?
It's horrible. Like this night alone, the light don't go and come back twice. So it's horrible. Not only the light, so many other things, and they were very inconveniency, but I dey hope for the best. Like I dey try for stay positive for like not ruin everything from the first week, and hope say the light go. But like yesterday, I think the light stayed overnight, but today it don't go like about a couple of times. I don't know what's in the go on. Maybe something is going on in the area, But for yesterday, light the day throughout the night. But so many other stuff then they win are like a big constraint for people that we can as alone. They really hope say then and we can really improve on them. Even sometimes, people like us, we try to put all these different measures in place, like, for make sure say we get the tank, the Miller tank, you get a generator, and like, but you can still find it difficult. Things are not the same, so I think I'm hopeful, because if I talk about it, I might get discouraged. I don't want to. I want to spend the time that I'm here very nicely and be knowing that I came to visit Salon. But I hope everybody when they come, just be prepared for some of the things and no more. Everybody's experience might be slightly different, but I hope that everybody come in safely and we all return back safely.
Inside the flight, are mandatory for wear the face mask?
Yes, not mandatory. Now for wear the face mask, yes, you get people that way maybe the only time you really go take them off. I think everybody is conscious and aware, then they wear them. Given the fact that we know from the flight to the kind of Africa, how they choke we up compared to because we take flight from United Airlines from Newark to Belgium. Then they I've been get space between somebody, but then some people actually get like two space, between. But we come from the flight where they come on at Belgium, or Brussels to Freetown, it's packed. It's way packed. And then not only that, you get people that when they drop winner free Nalunge, then the people then go continue na Monrovia. So think of it like it's all full of, we're not saying there are foreigners there too, but it's the way it's been done for our flights coming to Africa, given that we pay so much money. I feel say now something where the Ministry of Health, the aviation department get for looking to really na so them want for let them choke we up na the flight. We talk about a pandemic where we say okay, most of the cases then are overseas then and then for low day like that close, it's like we all been in the flight, you're talking about economy, even that premium plus, no matter what you take, maybe if you go to first class, but sometimes it's not worth it. Given that we come, you get for spend money, so go first class. Otherwise, I consider that. I really consider first class. Way if it been cost me like $800 from Newark to Belgium, then they're not being get any first class from Belgium to Freetown. So what's the point? So I just give up.
Because what you make I ask, we find out most of the time the treatment we get from Europe to Sierra Leone far differ from the one we go get from the States for come to Europe. It always different.
Exactly.
So
yes, and that's what I experienced. That's what I see.
Even inside the terminal, CSF they not correct because then go pass with we round and round before we find no terminal. That one they CSF not correct.
This one I want to say with this particular time, what you talk way I can even experience. You go through like some security. You can go through take a bus. This trip I not do that. Where the plane drop in at Brussels, then the gates will then give have been B28. So then it will not be everybody be like, wow, this is different, this is new, right? I think maybe not because of the COVID, then decide for keep them just in one area for contain, that movement, that back and forth movement. So this trip they not do that. But in the plane, within the plane, the number of people them it been just choke up. For me, I take and say people then they come over see, and yes, everybody where they get negative COVID testing because they not allow you for travel without it. Because I'm sure there was somebody who didn't do their test. They not make like travel. Then say, well, you're gonna have to go to the hospital. You have to get the test. You're gonna have to reschedule. That then I've been Newark it happened. But in Belgium, that trip from Belgium to Freetown, I'm telling you, they need to look into it. They need to find a way how them go really if they really want to fight COVID and for eliminate people and for bring, I mean, not eliminating, for try to contain the virus, for let the virus not enter at the salon, given that people they know they really take COVID serious. It's like yesterday alone when I went to my family's house, Porty, I'm like seeing all these guys without no mask, not wearing it. Like I said, where is your mask? I get my own mask on, I get double mask on, I get the surgical mask plus a cloth mask on, right? I get that now. I say, where you're oh, it ain't in my pockets. Oh no, it ain't under. I say, well, no, say, no, COVID now, they bring not so we. Like now that mentality is there. Like it's really sad. But it is tough for us, given that we get to go back and we don't go with any virus, know that we get to go back now, we jobs them. Right? For me already, I know before I come, the director don't say, have you thought about you're going to be quarantined? I said, really? You're going to quarantine me? He's like, well, it's not me, it's the CDC. Like I said, okay, I'll work from home. So like I already don't begin to put that in place. So think of it, people that they come here, that's not even the case. And then even the boat will take from Lungi,
because now that's next
it's crowded. It's crowded. Like I have to tell you, it is crowded. Like it's not happening. Like I don't know what God that place they have done it before. So far, in terms of distancing, it's not there. It's not there. So I guess we take and say because we case them all day as overseas, God not gonna make law case them. The AAA if it happen, we are doomed. We dead. We're done. So we just the hope say this is not a blessing to Salon and Africa in general.
All right, thank you very much, Doctor.
All right, thank you. Good night, everyone.
Okay, but anyway,
yeah.
Enjoy.
Go ahead, I'm listening.
No, enjoy, enjoy. That's all I can say. All right, thank you very much.
Okay, don't start getting jealous because this is all about you wanting to be here now. Okay, unfortunately, you have your own time coming up. This is my time.
All right.
Okay,
it is well. Enjoy.
Yes, it is. Okay.
All right, thank
Take
you
care
very much.
and get out for your vaccine. You're not going to say, I'm not taking my vaccine until Salon. Whose kind of statements standing? Really?
Na Salon Alexo. Na Salon me they take vaccine. Alex Salon.
Okay. And who said, everything I don't tell you, who said in the store. But when I don't already get space for them, so that's good. Lord hope say they will store and them places they own I don't suggest.
All right. Thank you.
Okay.
Yeah.
You're welcome.
Mm-hmm. Make we come with Tony. Make we hear what in Tony get for we today. Yes, Tony Touge Jones, you get the platform, sir.
Yeah, my family muna kushe and kabo. Me I'm gonna be brief. And not just one be labeled because when we talk about health and everything that is forum. These are things we don't hammer a lot, and so much has been said, and students don't say, doctors don't say, So I just want for I feel say the only side where I feel good is wherein the minister said they give $6 million. You understand? And which means, it's a good thing, even though there is a lot of lapses on the medical side, especially the health side, because when you talk about a sound mind, now when somebody else, when you talk, say, man, you understand, you make you feel good, you able to do bokuti, now when say yes, you're inside, okay. And I feel saying that one area where they've been doing well, but it's not as expected. Much we expect, say, with much resources, we down the pump into that area, they don't see plenty things where they go on. Because remember, see, health, you understand, or we will talk about medical conditions now in country, a big area, a challenging area, a very challenging. No we cannot the way go on Facebook or on social media where go see one salon person when a young person, promising person will die of common sickness, common illness. You understand? So if they can give them that kind of urgency, give them priority, say yes. When we self sick, we not go vaccine, how we treat ourselves, we will see much more things than we go happen. But because there's an alternative wherein if then sick, they can buy tickets and go medical leave or whatever, they can go abroad and get a better service. So it make them, they see that kind of urgency. That urgency, the priority, me want to see in the health sector. Wherein, because health is not like any other thing where you able for gamble, we get alternative. You understand? Health is not like where you will say, I get 2 cars, I will take this one today, I will left the other one. When you talk about your health, you talk about you being a human being, what make you healthy, what make you able for celebrate much birthday. You understand? In a good and sound mind. So nothing, because when you look so much lapses, we've said it so many times, we hospitals are not equipped, do not even get the equipment then we will say we for need. And we most times don't say it on this forum. That money with people in they spend for buy tickets, for go Ghana, for go India, for go South Africa, for go China, for go England, for go America, for go Canada, wherever in the world, France or wherever, for medical conditions. If we get those things they're within a country, then in our country, that resources go stay in a salon. And most of those businesses, people that will invest in healthcare system in a salon, they go for make money. We go see tremendous growth. We go see people that go get job. All these complaints where they say people that they done medical schools, they not get pain and they strain and they go as voluntary. Now because we get limited hospitals and what we get or limited facilities and we give for recruiting them people or forget those hospitals. Even doc self way so if you see say na a very good area, they get partnership or anybody where they listen, they can open a big business. But not only opening a big business and salon that kind of business, then you need the platform for the set. You don't just go open hospital, you begin on private power. You understand? Because at the end of the day, the cost of running those things will definitely eat into your profits. Well, you don't make profits, not even at the break even. So basically, all the things get for being set. Every things has to be in place. And now them all the hope. You understand? If them able to put those things to build strong foundation, definitely the building will be strong and it will be sustainable. Years go pass by, challenges and will come, whatever disease, whatever virus, whatever this. We for they do research. If we really equipped that way, even this COVID way they so right now, just like how Ghana then they do research, how other countries then they do research. We for also they lead, they give your own input in the research of COVID. You understand? And you're able to attract some more funds where you carry on because all this research going on, it's not something free. You understand? World Health Organization, they pump money into it. But what they call them, they pump money into it. Now, where will they able to go? So people then where they go school, people then where you pick in where they come up, they see that area like it's a viable area. But not everybody, most people then where they talk to, begin as the way you talk to, the only area where they see viable now salon politics. Now politics. The only way people then think say, oh, the only viable area for become politician because you go into politics today. Before 5 years, you don't amass wealth, you don't build houses, you don't get fleets of cars. You understand? And there are other institutions, there are other areas areas then if we give them priority, not only the medical, we get fast different professionals alone. We'll give them that kind of urgency, that kind of priority. You understand? Definitely, we go see we the GDP will cry. We go see the economy they strive. You go see in a boom because we go get people the way they can't find work in a salon because everybody you go just they flip jobs from one company to the other. They look for every side we offer you better pay. You go there, but we get for it. I mean, just like I say, they get for put urgency. They get for put preference. They really get for make them as a priority, just to put the care for any other areas. I mean, but as a nutshell, the last time we mentioned, me said it. Now, after it's not. I mean, a chemistry do. Somebody go say, yeah, waiting a call. That no matter. But once you're able to execute, no. It matters because if you're able to speak the language, health is not like any other field. It's not any other field. It's a profession where you get for get passion. I'm not a medical person. I'm in a different unit in the medical side where they work in America. You understand? But what I try for say here is when you put somebody it's like capability when it's not done the study, you know exactly outside the challenges and in case there is anything, you don't need for beginning diagnose, take positive, let somebody advise her. Because as you see, so able for know exactly the challenges there with it. So now me take that means I'm not say they are doing bad, but they need for put more priority and urgency in the health system. The young people the way they die plenty. Before me, I see me mama die for common sick way people and they live with sick in America, pressure and this and that. Now common sick. Once they take you meds, but you go to the hospital today, you medication say for them they give us substandard meds. Substandard meds. Meds no day, tablets no day. The tablet that way there, me man, it's not in hospital. You go to the pharmacy, then how authentic are some of those drugs? How quality you able to test the quality of those drugs? Whether they test them, whether go give back says, then drugs say how they come in now of high quality, now of high standard. Nobody is testing them. Nobody. So even if they build big buildings and this and that, they still have to look at all those areas because the patient needs good drugs. That's my take, Abraham.
Thank you very much, Tony.
You're welcome, Abraham.
Yeah. I want to say thanks to Tony, thanks to Dr. Aisatu from Salon, and we say thanks to Us friend. We try for make we able capture Usman Tole again, but you know, say out there, it's not an easy one. 2020, how we healthcare system look like na Salon. The Minister of Health and Sanitation, Dr. Uyi, don't give it in your report card. Waiting you say. Inside this report card, will land say government don't give UNICEF $6 million for help for buy equipment them we Salon need. You know how me see that one day? You know like way you dey send person we get money pass you. Being hopeful say maybe the thing the way you want it go help for full up. Eh? Eh? You know say this person look he get money pass me, but the thing the way I want, the money I get in not do. So you beg the person, say, dear, I beg, buy the here for me. You have the money. Even though you know say the money not get for do. I feel say now so I feel low. I hope say I'm wrong. But I feel say na that game day, na in Salon government want play with UNICEF. I mean then give them the $6 million. Say, you know what, we don't give UNICEF $6 million for help for secure for equipment. So if UNICEF go, they able to see the equipment and 8 million, 10 million, then go just full up and no more now. Say, well, let's just full up a lot of help there. And they tell you about how we Salon people and they think. Eh? Because you go one for one that say, okay, we then give them the money now on which term? In which term then give them by? For say, okay, there was an invoice, or now we be see the thing there, or just give them no more, like when the same person go mark it where he believe. Eh? Say there, who say they go? He said they go down the market, but yeah, take that 50,000 there for me, buy thing, I want can cook, you call the soup in name you want cook, I want cook cassava leaf, I want cook potato leaf, go buy for me. Eh? Or or you be say you then give list where the same person for gonna market. Because these are all the different ways where they send person. Then give list. Say there, look at the list too. I beg if you go down here and buy for me. But something they try for tell me say, they just give them for say there one fet malaria or one fet this or one fet and the money this so get on a help we. On a help we. But hope so go get where UNICEF car with waiting and go buy in a market for we. For help we. Eh? We then go buy with waiting and can with for help we. Hope say the minister, like I don't talk and so, he go can't tell we back say, well, at 6 million will be give UNICEF. Now so and so now then spend do. Ha. The Katie say now because UNICEF then go sabi buy, say they no go use third party for triple the price. That's another one again. Because we don't society they buy inside tongue. The sole one they were responsible for selling this tongue, they still go through middleman. Hi. Anyway, we don't hear that one day. Kariaba say, he say Tripoli, we no need for expand the hospital. But what we need now for equipped the hospital them. Okay, me go call this caller. Yes, caller, your name and no side the call from, please.
Triple, this is Alaji, I call from Maryland.
Yes, Alaji, you get 3 minutes. Waiting you get for it today.
First of all, first question was how long this man I don't deal with that Minister of Health Day? How long?
If I'm not mistaken, from where this government come, either somebody be did it, I can't remember. But I think if I don't did it now, a little to 2 years or over 2 years.
Now they're not able to do anything towards that hospital day. I mean, we didn't ask for the recently blackout the people and they die. They're not able to do anything. Now they say they don't go give UNICEF 6 million for equipment. What they don't even put lights at the hospital for the hospital get 24-hour lights. So what that they use for go pay for the equipment and then way if they back they can't sit down, lights go, lights can't, then pull. It don't make no sense. We make this hospital here, we upgrade this hospital here, make sure the hospital run on 24 hours lights. Make the rooms there. You know, people in there so where they can able get in touch with, you understand? They nurses in there so they can able get in touch with them, they talk to their hospital when they so for them bed they don't need again. They get the plastic when they put power and they give anything and the only time. The hospital bed they give it the only time. Why make they take the pride and put it in their pockets, then they kill people in the country? I mean, we not know say hospital are the number one priority. If you don't get help, you money will get, you riches will get, they're nothing. And I don't blame them because when they take the money, they and the family there, they go overseas for go get themselves well. Then they consider that the country, the last people there. How long this they go on? For small cottage and Connaught Hospital, who know that. Now the people that go born, now the people that go take. Now if you go there inside and it's just the way they work inside building one of get nothing. Yet they can say they put 6 million for UNICEF for them go buy equipment for car. For what? Who said they put there? What the hospital today? It didn't no make. Come on, man. Then the people that stop for give people a bend business. Enough fear, man. Enough fear. The people that they for you they go sleep. They think say what they do so it's wrong. Are they even thinking about that? Did they think about the ordinary people who they go to hospital? Excuse me. When they go to hospital all day for the bed safe nothing at the place there. Which you go the set alone at the hospital if you never be in the commodity. How long we go there for the thing a day? Then when I couple 6 million, say when I go buy equipment. It's simple, man. Need the people, man. Just start with them. Thank you very much.
Thank you very much, Alaji.
You're welcome.
Yes, caller, you're live on air. Your name and no side the call from, please.
Hello?
Yes, you're live on air.
Yeah, Triple. This is Nakari about from Maryland.
Yes, Kadi, get 3 minutes, man.
I don't know if not hearing because I didn't have a job now.
Yeah, they get you loud and clear.
Yeah, Triple. One thing about the healthcare, we person sick in this country, yeah, the first point of healing that we go to hospital because you get hope, say, I don't can hospital, now they can mend me. But when you go to salon, it's like the first thing where they think about now death. Say, oh God, they can't die, now yeah. So the thing where people aim for, do not to for expand the hospital. Now for renovate the hospital, salon we get all we not even need for begin the order for things. We get timber. Why we're not able for build real hospital, build them? Why we're not able for do the little things, teach the nurses the universal precaution, for teaching bedside manners, how for take care of patients, because that's the first contact to illness before the medication and they come inside. But when you go to the hospital, be as a nurse, when you go to you have to all the poor nurses, then they wear the same gloves from one patient to another. Then the way where they talk to people, even the way where they work, AAA, it'll make you sick more and more. Salon no need for expand hospital. Salon need for equip the hospital. And we get everything as salon for equip the hospital. And also, if at all we were there so because we want the healthcare very good, we are nurses then I. If salon people they can allow we once in a while where we go, we get elect 2 hours just to go teach down and the bedside, especially the nurses there, because they talk about the nurses there. Now they're gonna the doctor the inside. So we all need to come together and do something. But that expansion of hospital it don't make no sense. Because you expand the hospital, you still not the waiting the hospital need. A small hospital, as long as it's well equipped, Now, very, very important. Now, that's me get for saying a job.
Okay. Thank you very
Okay.
much, Kadi. I believe say Kadi they talk about the hospital them. Then Michael Cocker say anything say we need modern hospital with units them, like where then go they single out rooms them and get modern amenities rather than just that one pala we get na salon. The other day, I be they talk to somebody where then go admit in Mama na ward 10. I don't even know say still let Salomon gets that thinking say if they admit you na ward 10 you they die. Na cannot. Eh? 30 days Salomon then get the thinking because I was talking to somebody the other day. And they tell me say, oh na ward 10 then go put her. And because anybody who I tell them always say na ward 10 the day people they are not happy. Then so for go try make us see if they can able to change the word because we see them put you in a ward 10 it did near mortuary. You just they go end up in a mortuary. From where we small, where would they come up? Our members say we be get that word they will be they go around where they say ward 10. If you see them put you there, that be say they don't give up on you now for make you die no more. 9 and 10. I remember that. So inside 2020, for me person still they tell me say ward 10 the same thing. I was like, So where Kari they talk about renovating, fixing up things them. That was 10. That stigma where they don't left Parandi. I don't think say go change just now. Me I call this caller. Yes, caller, you live on here. You name and no side call from please.
This is Ezekiel. They come from Oregon.
3 minutes, sir.
Thank you so much. I think they identify with the first caller. I think definitely if anytime people and they talk about development, obviously important and necessary for the country. However, I think now the priority I would fail for always realize first things first. You know, AAA, you don't talk about over and over. If we get a good electricity supply in the country, a lot of things and half job then go create so easily. A lot of people like how machine the manufacturing machine then they're so cheap now for acquire, within that country they packaging a problem. So I think the first thing we therefore always concentrate on, let them get full-time electricity supply in the hospitals. Get 24/7 electricity supply in the place. Get electric, light supply in the place first. You go out heavy equipment where they consume a lot of light, a lot of current. Then get enough light for keep them up. Now once no more power they come high one, it can mess them up. That you $200,000 equipment we buy, don't pull it inside one day. Concentrate on the first things first, fix them first before you begin think of other things, because that's not the main thing that we go able use for let other things that function properly in the place. Come on, doctors, all doctors in all kinds of area, PhD holders. Now we put first things first. Me not that no more. Thank you so much.
Thank you very much, Ezekiel.
Yeah.
Moses Flomo they ask, but I see a lot of people not answer him. Moses Flomo they ask, he say if we get children's hospital in a salon, yes we do. We get the Aladirin, we in a PCMH, and Princess Cummins Maternity Hospital. Then we get under 5, where they by Upgon, and by Ross Road, Kleintown area, and we get under 5D. So yes, we do. We get hospital for picking them na salon. I see people they want for agree say light na the key to all success. That I'm waiting Jennifer Senesi say. Yes, caller, you live on here. You name and side call from please.
My name Koma, I call from the United.
You get 3 minutes, Koma.
Yeah, your analysis towards salon for give money to UNICEF not really they far from the facts. I only wish, UNICEF will actually go in for the urgent equipment they will need in the country. But AAA, wait a minute, say no more. Medical, we all know, medical not so something we look cheap at all. Then the other thing back, I can always say this, salons so they backward that, at times, working comfortably, you don't lambast this particular government or any government today in power. But believe you me, the backwardness of salon can make at times any outside and start working your office, they don't do well. Then if like when it's government become then be frustrated, that full security. Some of you before stealing now corner the home will say no. Then before don't consider health first. If then jump for health again, no, sometimes we'll begin to talk say no. Waiting they cause bad health, now we better not in the country. And when we can again and jump our business, maybe we'll sit on the talk about sanitation again. So, the problems are so much that, sometimes, when the government, they try again with the officer, the money absolutely do nothing. But then I'm your contribution. Thank you very much.
Thank you very much, Kuruma. But Kuruma?
Yeah?
Tomorrow, we want to talk about the good things the government do inside 2020 and the thing they want to not do, want to remind them for next year.
I will do my job. I will squeeze.
Okay. All right, sir. Yeah. Yes, caller, you're live on here. You name and who side you call from, please.
Hello.
Yes, you get me?
Yeah, I get you loud and clear now. Triple M and Mohammed, I call from United Kingdom.
Yes, Mohammed, get 3 minutes.
To be honest with you, I agree with most of the callers. Them Connaught Hospital, then a very nice position for the country or for the city, Freetown itself. If government try to renovate Connaught Hospital and get the doctors that are needed in that hospital, there is no need for most of them to be traveling to overseas countries for treatment. And the second thing is, you mentioned something about Ward 10. Ward 10 is like ICU units in Connaught Hospital. But because of mentality of way people, the way we grew up with, say if they put you there, they die. And to exactly like I say now in 2020, not to something where some way for a from somebody anymore. So we're not gonna blame them, we're gonna blame the government. Yes, however, not to every do for the blame government, because even we self they contribute. If you go to Connaught Hospital now, they tell you say no and I feel he would be angry. But there are some things that the way this yes, even the layman as alone need for learn for change 10 things a day. However, even government put all the equipment that needed in that hospital, if they're not looking after them, my brother, a waste of money. A waste of money, totally waste of money. So for me, for say they extend the hospital, extension not needed for now. Let them refurbish the one we don't do first and they keep them. Then go think of extension. And that only needed for say.
Thank you very much, caller.
Thank you.
Umar from Minneapolis say really under 5? He said that they not look correct. He say because the under 5 were in Sabi, you not go recommend them for anybody. Well, na question the person asks if they get children's hospital. So we get for provide an answer. Inside December, I be get a worker, na say a network, where in Manuel. So end up for go na Connaught Hospital. Okay? When I reach there, then go for the hours first before then be attend to them. Now, when they attend to them, you get, because I make you explain to me. A rather be say it got all late now and for it on and for be don't bring and come on board make you explain. So the encounter no correct. Like how Kadia body talk, the nurses them. I don't know. Our system in Sierra Leone is set up in a crooked way that I don't even know how to talk. Because we all know who side we dey. Person within at the admin side, na the admin side dey. Na they deal with. Other day for who side na the floor, na floor dey na they deal with. You know they deal with admin, you they deal with floor, you they deal with this, you they deal with that. Yeah? Okay. So your encounter was like, then begin call for money, straight up. Straight up, then begin call for money. Okay. Saying give the money, any money you then call for a gig, any money you then call for a gig. Then at the end of the day, then call for another money. I don't forget waiting. Where he no say they not for ask for money. So when I ask them two things, when I sure say I for pay for this time, they say yes. Hey brother, I mean when I sure say I for pay for this time, they say yes. So now he pull in Sierra Network ID card. Now I say no, it's make the ask. They say because me not journalist, he pull the ID card, he show them. Could you believe say they not take that money there again? Just because you don't say in a journalist, they're afraid for collect the money. Even though them be don't say yes, na money way you for pay. And the other thing we then complain about now the attitude of nurses. And from them, we don't they get 10 and then can you take a pull story. Say, oh, my one born because I say, I be the way they enjoy. They are beg you try for we this and that. The attitude of nurses them. We not they try for cry down we nurse them, but I believe say in that department we have a lot to do. In that department we get beaucoup for do. But again, we can go till we can. If government want for use them people and they as volunteer, they not pay them. Then just set up the system for fail already. Fast forward. I don't know. Me Tripoli, anything we concern Sierra Leone, as long as you get the name Sierra Leone on YouTube, now one go they want to watch it. And sometimes I see opportunity for sell Sierra Leone in a positive light, where I think we they miss we as Sierra Leoneans them inside Sierra Leone. Okay. You get this lady we na from the United States. If they try if they go to African countries them, it goes along with in Pekin. It goes along with in Pekin. Arriving at the airport for take the COVID-19 test. Imagine then separate the mama from the Pekin. Then separate the mama from the Pekin. Where we all know say Naya, you dey enter with your Pekin. Waiting different from that Pekin and the mama for do the test. And Dr. Sevda explain and Naya, so the woman back explain and say, then go take you from one side, can you go other side, this and that. Long matter short, the woman go inside, you want go to Pekin and not agree. What the woman cannot do, they don't take the Pekin, they don't put her inside other room. Somebody who know one day go salon. So we cannot do now begin ask, so when me Pekin? Then they say, oh, they don't put her inside that other room and they doing test today. So the woman begin say, if they can't tell and say in Pekin positive, they not go get her easy. You know, they small thing. Then small thing who they miss. How you go separate mama and pikin for take COVID test? Yeah? Fast forward, where they ready for turn back. He say go na special court for go take the test again. He said the person we can do the admin. Now the person now ain't go inside back for do the test. So then they go ask you, say, what do they miss now? And these are people, these are not Sierra Leoneans. Not to Salon people anymore. Because I tell you, say, I get to exploit Tripoli. I dey try for see the areas them all they miss. As a country. The area they all they miss as a country. For try for portray. But again, I dey look to the one they don't go Salon where they give you the encounter na Sierra Leone. And inside that woman in video, I see a lot of missed opportunity where we get an opportunity as Sierra Leoneans them inside Sierra Leone for make people be like, say, oh, okay, Sierra Leone is good. God help Salon. Joe Bangali say Tripoli, some words them, the nurses then get their own personal blood pressure monitor machine. Anytime we then check the blood pressure, you pay 15,000. That is true. Then they not a secret against it. And I they tell you, pass if you answer, you not get somebody way this Salon way na no so. Because trust me, then go beg you the blood pressure monitor, then go beg you the one for test the blood sugar for the diabetes, then go beg you everything, make you send for them. Then at the end of the day, then go tell you, say, oh, because you know it's in, then they pay small for her. But the nurse system in Sierra Leone, then get work for do. They really get work for do. This lady go na cookery shop. Somebody, you know, like those Pan-African people, he go na cookery shop. He say the hotel and they charge way too expensive for the food. So the keke rider will be the take him along and go na one cookery shop. Imagine. The lady waiting at the cookery shop don't even know. I don't know if now because na English the woman they speak, but I believe it be the cham and small, so instead for able. The woman they do in video, the woman they record. The woman ask and say, who side this place they? For even get that direction they look and they don't come under. It is struggle. You. Because the woman they say the food is nice, and they try for say people the way they come, we want go eat cookery, you go get them for cheap and what not. Maybe you can get good belly. So you go carry it now. Now they ask the lady, say, so I hope somebody go fenia. Then they, hey, wahala. Now I ask her, say, you get phone number? The lady just goes, no, I no get. And I know say you get to, he just don't know the opportunity we don't miss that. But you man go na another cookery shop. Now one day, he go get more customer if that woman they get followers them where they go. Because he explain again number, he explain who side for find the place and everything. Two different people them, two different approach. Two different people, two different approach. We get opportunity in Sierra Leone for sell salon, but if us not sell you, treats not go buy you. And that's why I have exploit AAA. Not that bad sello. Tell me say the video they want don't upload. It don't make you feel proud of Sierra Leone. Tell me that one day. About to kick about say don't send you know, I have my personal one that I use in community too, but I don't charge. Okay. I have to kick about say, you know, inge yumbo you need a charge. Memzo be safa saying don't send BP, cough and pulse oximeter for a nurse before. Because if they take and make money over day. They need them. You know what make I give them few 1 year? Now because Sierra Leoneans them customer service will not sabi. We don't sabi. Customer service is non-existent in Sierra Leone. And that one day they affect even the medical area. It affects we big time. Customer service, nah. Because in like how the politicians them, when they do waiting they are hired to do, then fi say then they do favor. Now so the people in back they work in a different institution than Sierra Leone. When at that one day they pay them for do, they still feel say then they do we say favor back. They still feel say then they do favor. And sometimes not feel say now just the one way they work from the boss then. From the boss then they not sabi for talk. They not sabi talk at all. They just feel say now if you don't want to left and go. Now one store then you go then coax you. But even if then they coax you, just get question. Just get questions small about the product. May then change by you. You go forget saying that you then be the coax gist no. Joe Bangali say Triple talking about the mentality about two people and where you go salon and try for enlightening, then the reply you get from there. Now so we they do naya or now so we did naya. Yeah. Then they in common. It common. They tell say bruh, and so they naya. Masa you know be say think so for open a school for customer service education as salon. Even with this way they complain so, then go and tell we say, oh, now because I don't go by and I feel to say no more. I say the internet is down. Go na the Seratel office. You know what they say? Hey, they say then I for sell no more than they for. Then they do for the technical. If you want to talk about the technical, if anything go wrong, make you go to the head office. But go to the head office. And they are so comfortable in all areas. They are so comfortable in doing what they do. Even though na poor service, the phone, you cell phone. You cell phone, just call. Even in Sierra Leone, when you choose English, if you call, you choose English. The person, as you answer, where you find out you're in a Sierra Leonean, he want to talk real to you. Then the two way they call for you go there forever and they no go solve her. They no go solve her. David Banks will say now true. The customer service is very poor in Sierra Leone. And that thing, now then they be they teach in staff in a restaurant. I talk on air, was it? No, not to be this last time. The one before this. I think that was 2018. You get a lady where they promote, you get a little restaurant at the center of town. So they promoting restaurant. So I be don't promise them. Then I want WhatsApp group always. I say when me canton. If I didn't know that area, now they are going to eat. I talk on air before. We say I go there for go eat. Okay, most of the time get the Sierra network crew. Just because you don't know say person they will come over see. It inflates the price. Inflates the price. The other time I come over there, I text the lady. Tell her and say, oh, na so then charge. Say, oh, I'm sorry, this and that, not to sorry for B, but I go the other time back. I don't meet that first person, I go the second time back. The person I meet today back. Just because you know see somebody there among will come over, see, he inflates the price back. I'm like, man, these people, you know what? Just forget it. Eh? Everybody they say we need for educating our customer service. Hey, bank workers. Yeah, Joe Bangali, Joe Bangali says, look at Ledonkan and exactly. And the way they treat you, then body language, then looks, sluggishly. Like saying, I beg you go big. Eh? Ibrahim Kuruma say, a friend from the UK, Papa be sick, and can't go hospital, so him be one for talk to the doctor. He said the manner and the way the doctor respond, he not be encouraging at all. I like to say, get somebody they call him phone every day. So the day when decide for speak English, the person say when you say wrong number, the person not call again. Okay, David Banks, after this program, we'll go talk, sir. After this program. I say me policeman, like that day I was running for an appointment. Then block the road for that. They say for the IG. I was like, man. And the policeman I tell me, I say, Paddy, just go down south. Yeah, big. I say, but this is not right. I say, well, Nayana Salon. Say Nayana Salon. Like when you go busy, they do something, policeman just come break me. What you want check for? He say one check for fire extinguisher and me na the trunk. He want check for triangular. He want check if the headlight like I don't hey Papa God. Salon is blessed. That's all I could say. I make way people and say bank they know the people they know the bank. I say go na bank. You know the meet bank empty. Always bank full up. But now would they you know where people and they say the bank are the worst place them. Yes, that's true. They not get the bank workers then a saloon. They feel anybody who they work in a bank and a saloon if you say they don't arrive. Just for count people money. I just put that away. But then feel say they don't arrive. We're not looking down on the job, but I think there is this mentality for Sierra Leone and say anybody who they work in a bank, he gets something. He get the extra. So the workers in a bank feel say anybody who can they, unless if you get connection. But if you not get connection, you say you go to that line there. Eh? Hey. Mama Dujala, phone line don't close, no calls. Keep her next year. When I Saturday. I remember at one time I go do bank transaction. So that Sunday now I don't know for one reason. I think I'm American passport now can go. Because the person, a person transfer money, then in say be no say me get salon passport. So instead of a strain, he give me name na the bank to the manager, and I tell the manager say na American passport me the carry it. So until you know no more now. So I go, I tell the manager say na me, then announce na you, can me go inside office? Yeah, you don't know more now, eh? So I give me passport. But my dear, that my passport I need to play with her. I need to play with her more. So you don't go first, you come Asia and Ayan. So the ask and say, you say you go photocopy, right? I say need for make a copy for sure say and blah blah. I say okay. He come back here and make like say he carry the photocopy one say you don't photocopy. Now I say what the passport? Now I say I left her inside the machine. I say I go there at another time, but the other time they go there now tell me man say I say hey, tell and say they go to ID card, yeah? And they go to ID. And I ID now I go with. So I reach back and ask me, say, what the passport? I'm like, okay. So what's in the passport get for do? I mean, driver's license I go with. I tell him, I say, I get driver's license I big. Just put this say that driver's license now I go show. Go put passport again, do ya? Even at that now, that one they get for making out the tip for look big. Because you don't pull that kind of passport today. But in Sierra Leone, the bank workers them. The one they work in DBN. There you can align, you no get connection. A big. You all get, you know. Miami Ibrahim. Bank workers go take your check where you go cash, say then they go verify amen for let them come back now work. That's true. And some of them I'm sorry, but some bank then they go, man, I'm not capable. They don't make one or two connections for don't do them before they reach this, so I'm not go spend that unnecessary time. It's sad, but that's how the system dey. Asi banka say people left. Me na banker, but it's good. The customer service no exist in Sierra Leone. You know did it. Remember that Kuroma say then they look down on people too much. Asi banka say they always get problem with that. No matter how you train them for understand that the customer is paramount and always important. Now the money, and then they use for trade. Exactly. Ezekiel say na decision, na they decide for make wealth. If you decide for talk nice to people, you have moved them to do unexpected goodness for you. That's true. That's true. Franco just say we get the yellow card ID, no need for standing line. Michael Coker say, it asks question, say if the bank workers then think say they're superior or what. To me, I feel saying so they feel low. Dave Banks say he say the city council for make them a priority for make vendors them for complete a customer service class prior to obtain vendor's license. That's true. That's another funny one at airport. Kariaba say he don't go use the ladies' room at airport. Then the woman with the clean and she hold the tissue like for one reason I don't know. Then they ask Karibak if he wants for use tissue. Where you know say he need them. But I think in every aspect, because we started from the nurses, their attitude, now the hospital, to every area, that customer relationship, as long as that person end on the other side, it's a difficult one. Even the phone companies, them, if you work as if going at the offices, them, it tell like saying I beg you to go big them. It's unfortunate, says, because some of we maybe we don't see the body them or the way we can look one kind way, even though we can dress common and all I feel say now the hang towel in the neck or no. Can dress common, maybe they can able still fishing way out. But sometimes, man, customer service in some areas the way you feel say even the EU building, most government offices there. No, the last while ago, they pay 10,000 for trolley again. Joe Bangali. Now na free. Dave Banks say your topic is extremely informative. Happy New Year to you and all the listeners. And same to you, sir. I make you say we now una the real Liana Salon. Mama do Jalo they ask, say why for big bank worker when I in they give them money. Well, go salon, you go land down one day. Sierra Leone? Yeah. I don't know if it's difficult. But like me, I can always get the talk. Me, I know, I talk to you, Safo, slowly, understanding. Even, you know, like when people like say, oh, bike rider. No, not to me. Oh. Yes, me, I dey take bike now alone. Most of the time, I can work out in the evening. I work out from Hills, take around police station, but I need to go work go back. Oh. I dey take bike. At least I work. And the bike what they take, before I sit down, they would get the talk. Nobody know they gonna tell you. You get for be careful. As you claim me so, now so you put me down back careful. And it can work. If you do rush, and thank God they can boku. If you do rush, I know they go. Eh? Huh. Rugi Ivy Blue say, he say in boy picking, then go for good window shopping in London because he just come up from salon. Now he say he want for go inside the shop without buying anything. He say would they go for go and then shop them without to not buy nothing, just they go look. Now he say he answer the picking say yes. Now he ask and say why they ask. Now I say because if na salon, then go cost you, then go alapa you, say you go there, you not buying nothing. He say now I tell and say now because customer service no dey na salon. Customer service, and I can't today. Eh? Richard Cocker say they not sabi that to customer service, you know they na salon. Adam Mansai say the system is bad, triple and everyone. They go with the trend. No one for stand out for do the right thing. And so that is bad and sad. I advise anybody we don't say you know go salon, let you know go December in first skip. Cause the stress go make it say before you go back. That's not what Joe Bangali they say. Renator they ask, he say, what about the restaurant and the waiters, the waitress, some of them get in every aspect of Sierra Leone. Me, I don't go for go eat, yeah? I'll tell you, talking here. Where we go, I was expecting the waiter for come and can't take we for go show we a table. So we stood there. We stood there for like 10 minutes. And then ladies here they pass, just they watch we. Eh? So I began for call one. I say, can you please? I say, for more come, we don't team up na ya. I say, everybody they pass, nobody no can ask we, nobody no can usher we to a table. And I say, oh, no, any say we see MTC, don't know more. That's exactly what they said. He said, any say we see MTC, don't. Yeah? You go say that one day, now be top side because not too cheap food. And there is, and I just don't want to call him, there is another top-notch restaurant in a salon. Same thing happened. We went there. That was my first time going there. Don't pack. Waka go inside. It's a big outdoor place. There's pool and everything. Not knowing to say, then they expect you back for go fancy don't place there, go sit down. So I stood there. They don't pass 1, 2, 3. So I get for call one. I say, excuse me. Then they tell we say, oh, no, any side where you see, like top notch. Any side where you see, just sit down no more. I was like, what's wrong with us in Sierra Leone? Or is it not because now white people are in Bokude, so we the black man and if we're not able to afford for buy food today? I started thinking like that. I think like that. Say because now white people and so there's not too much of black people. Maybe I see few, but the few I see them get rapport with them. So maybe then sabi them one then they. So like me, that was my first time. They not sabi me. So then just feel say, oh, sometimes this you're not going to buy food now or what not. And to be frank, the food was not all that. Now just name no more. Yeah. But why do they do that? Yes, I don't go other side them. We na real top notch too. Then they usher you and cow the menu. But again, some side and they man, we see them go make that food. Go where you bell full. Go where you bell full. Because before that food they can. You can tell like say they don't forget about you. I don't go eat another side. Cold food. I didn't carry it. Cold food. I didn't carry it. The person where I go with, you know eat. Say no want. I was like, oh my God, these people. It's alone. You don't take time for cow tobacco. Wake out and buy the food cold. But hey, I see. I know what I'm talking more, but now you don't talk now. Eh? Now you don't talk. And that's a top restaurant in Sierra Leone. That's exactly what it was. Because I think the other one then filthy, then we would go to they think like, okay. Huh. Oh no, begin safe. If I may they can listen. If I they can listen, we. I will make a give Bo Plaza and Kenema Plaza fail like, because of the food they will go eat today. The customer service in every area. Every area. A question, Macna Salon. Kadiaba say, say na just on training. Eh? Ah. Mama do Jalo say in the eat and it was fine before you go na treat. I'm telling you, some places there. And for me, for one reason, mostly where I can go out, I can like I go eat out, then I can take food in the house. Maybe because you know say oh they Waterloo, I no one drive all the way come again at the beach area or go na the areas them. Sometimes, eh? I left so no more. Même Zobi Safa they ask if then they serve appetizer whilst you wait. Yeah, some do. But even then they back. For wait for that appetizer, you gonna need another appetizer for wait for that day because it take forever back. Eh? It take forever. Who do it in salon restaurant then we know. And they serve you the appetizer because if you choose for ram, they will. But since you get time, we go take for cam. Richard Cocker says, Tripoli, you know, traveling a form of education, we learn a lot of basic ethics. Renita, well, you not master at the kitchen. So definitely. Renita says, if the food not good in the send them back, he always they do that. And then go ask for the chef and then go express in dismay. Musa Conte say Kenema Plaza and Kobe get good food restaurant, but na back then. Well, you don't see. Well, make a I tell you the names of the restaurant and the plaza so that you know go other big one them. Seriously, man. But guess what? Yeah, one of the restaurants where I go, we waited for 10 minutes, and after I talked to the lady, I went there at another time. But I don't know. I think the lady be done I'm queen now. So as I go the way see we, now first can greet me, go show me table. Can they ever send to go open your place next year? Na McKinney no. Ah well, you see, we clear. As you can say the best restaurant na Central Police Cookery. Okay. Yeah. But anyway, we don't talk today. You know, say we the end the year. So you can find me with the gist small. Eh? Each kakale say you need for make we know them, please. So that we no go there. Okay. Exploit Tripoli. The camera is going to be rolling now. The camera is going to be rolling. So now they will go able to get the name them. Yeah? The camera is going to be rolling. That's all I go say. And they'll go get the name them. But the way how it's sad. Customer service on Pantap with your money back home. Pantap with your money. Like say they not call we. But to go see. Yeah, Adam say Tripoli na una say network for can't change salon for the best. Amen, amen. Career was saying go did fire in staff there. First of all, like what they don't see Tripoli don't can they not increase the price first. As long as you not get the menu. But I think that's the other thing. That restaurant then they increase price, they not get menu. So then they increase price. Just the one they will make in the work out with. Where see, I can just say, let them count the bill. Where then can say a network. Trust them workers then then they take the bill and begin calculate everything. And they calculate everything. Musa Conte say the problem with customer service and salon. He say one can wonder whether a willful ignorance or not just being ignorance of the fact. Hey, Joe Bangali, I talk and I just don't say the police there. For one reason, they will just stop you. Say they want for check for fire extinguisher. Like seriously. Like seriously, fire extinguisher. Mega important. Like one day I was mad. Because I don't sit down at traffic for long. The small open where the traffic open, me they run for go side, they go. Police can't stop me. Say one for check for fire extinguisher, triangular, this and that. Then the other two ask the police, I say, you see the license plate, right? You see the fresh license, eh? I say, so if you feel a fresh license, then you see the car, then you expect say from go transport I get everything. Eh? Then they ask for the driver's license and pull and gear. You see and say, oh, okay. Overseas license. Then the other lady now they try for be rude. Because you know say I be done vex first. So now because EC say now overseas license, they think to say now make me they try for vex say when they stop me, this is just unnecessary because time is money and they run for goes on side. So the boss the boss man, they say, oh, okay, we understand, we sorry, this and that, trying to be nice. The lady in the behind the open your boots. Open your boots. So I calm down, open the boots. Then they say they want to see the fire extinguisher and triangular be just there right there. I open and show them. Then the lady they say, I want to see the spare tire. Then the boss man say, no, you can go, sir, you can go. I look the lady, I look at her, just shake my head. Spare tire for waiting. How you connect? Really what can they for do? What the person broke down if he left and they una get a ticket. Na get a ticket if he left and they. But salon, some of the things they wouldn't ask for. When this one another boat checkpoint. Because we be travel for the day between Jala, Tayama, and Bo. Fast. Okay, until you don't watch the video, they go trip them. You watch the video. So, also, the first time they break we. I be traffic warden and they come you want to see the driver's license. Ashwan. You watch and say, okay. You want to check fire extinguisher again. Now I they make fun with him now, lady. I say, if I can't do it, go get for pay me. Then I can't down Ashwam. Then he say, okay, good, bye sir, we don't go. So they pass back. So I think we don't pass 2 streets, they don't see. So then go don't talk say, oh, na JT, na in this other motukadi. So the other time, this other guy break way at the checkpoint. Where he break way, now he say, okay, because the car is tinted. I say, no, na face number boansi. I say, because this motor don't sabi and I don't pass up and down now. And because where we go, the camera is always on the car. I fix camera on the car. I say, I see you na the video we up and down. I say, now you face no more now and see today. I say, oh, okay. Me face you and see, well, you don't see her now. See, because of the motor thing to know they see that inside. I say, but be don't stop me now. Because I know say that other person they be don't go talk say na foreign license I me get. So you be must don't go talk there. So I say this and I say, oh, okay. I think I don't forget how much we get. Say just being nice. But they were nice though. They were nice. Maybe they try to get a friend a tete-a-tete with we, but it be nice. They know I'm buggy. Joe Bangali say, you know, they ever give them in license. Say always they get photo of in license and in phone. They put they give them the other 10 they don't hold the license and begin argue among themselves. They all take the license now they ask waiting for do. I just see that they watch them. At the end of the day, now they can't over my license give me. I can get it. Kariaba say now you face you want Siba on a money you want. Well, you already know. Memuna Kuma say not to you face so na money now you want from you. Yeah, you begin get a chart and what's not. The one they will make vex, but like that one day, okay. Now the one they will break you unnecessarily. Then the way you don't get the license and because it's sitting for your license, it won't be nice to you. Those ones I don't take. If you want to be nice to me, I don't need for show you my license before you want to be nice. Say, oh, nah, no, Or then if you say people in the Komoya where they go, when they get license where they drive. Like I don't talk I want them. Say, I forget my license na house. I don't feel good till I return. I don't feel good till I return. Because it's part of me. Because I don't know and I don't want issue. So they drive, you don't get license. No, me, I get me license always. Ah, Salon? Can they ever say the police that they take the money, then they take the prep planting? Oh yeah. And then checkpoint, we see them kick and they begin peep inside. We see them people, then you see them, me and net I can sorry for them though. Net. Brother, I see studying there, let's see no more now and this school. The one in a regent, sorry. Regent. Yanda king call na net, a checkpoint where did he? Ah. Sorry, Yanda. Round on today will start from the 2020 healthcare system in Sierra Leone. Look so kind. Customer service will don't end up on police. Salut, un case. Yes, Madam Musa say you oversleep or show. Go lock the domot. Makama say if you give them money, they're not going to waste your time. No, but if you don't waste me time already, why should I even tip you? Eh? Why for tip you where you don't waste me time? Like mostly, Usai me I can get issue with traffic warden and police them. Now we be say like we just clear Mutuka, you get that 2 weeks. That 2 weeks, eh? Huh? Then they see say you get the paper tag, then we must break you for waste your time back. Joe Bangali say Triple, you won't forget another say unnecessary harassment kinde. And another area way then they ask for the yellow card. They did that to me 2016. Yeah. Was it? Oh, I forget. We I go salon. And he said, would I get a card like can I would I get imagine entering. Not to live in entering. So I be there explain that story then I. Okay, then put you in a corner. That's fine. I think I not be get Leone safe. And then show me for change money. Or go inside the room. And then say you not get your card. So I pull the salon passport first. And they first an them down. And they say, a salon passport. I say yes, a salon passport again. And so, well now brother. So well you need the a la carte. Now say they don't explain. They're going jumbo wumbo themselves. Now airport too. They're going jumbo wumbo themselves. What they done? Now say so why I need the a la carte again? And they say no, you don't need them. Where they come on, where they return. I say, well if now why they return, then why you can't hold me now? Because they say, well if I just give you small thing no more. Now I give them 10,000. 10,000 Leone Snagi. And then begin laugh say, 10,000 the a la carte first no more self not to be 50 or 100,000 man and in there say or what not. By the end of the day I not give them nothing. I take my passport commodity. I say why they turn back when I ask me for the a la carte. I don't dare be telling. I say why they turn back when I ask me for her. As long as you don't tell me now say I don't need her for coming inside, then why would I pull me in a line, can't put me for waste me time? Eh? From that 10 day, why we don't know that now me then we'll not get that issue there. Not get that issue there. Salon? Alaji Selassie say we either drive na net they give them money. Well, you know been also a funny parcel. The front of the car, the same way I been get the temporary license plate. A Sierra network 9 be right today. The license plate and Sierra network license plate 9DD. Yes, Sierra network official license plate Sierra network. So then police then are net. Me said that me look now after I get the Sierra Leone license, I pull the Sierra network and just put them. Eh? The other police they break me. So na Sierra tell na get this motoka. Pan Sierra network oh. And Sierra tell him. Can I say no? I say so you put Sierra. I say no, na the license plate where they before. So whose network this? Whose network? I say na Sierra network. I say you know Sierra tell I say. I say well na whose mobile company? I say hey, Papa God. I mean I don't see me on that today. As soon as the salon license plate come out, I just pull the Sierra network. Because most of the places where they go, where checkpoints there, as they see the license plates. Well, this license plates are waiting. Okay, Papa God. So as the salon license plate come out, now I pull Sierra network. Sierra network look like say they don't let you now. Ah. Well, that's what we left here today. This Sierra Tel network. I'll come to go like back. I make the other day now. I tell we say, I don't know for you, but for me, I don't get nothing for offer me. Now just the love. And they can me go there. Jenny Sabango say if you enter salon with car we get foreign license plate, and you go see your own. Voila. Even with all the documents, then we'll still come up with something. Exactly. Eh? I said that I tell you so. That's your network license plates number will be the front. Now salon. As they see, they don't attract them for stop the car for like me tired now. I'm tired now. Say you know it in say network. I want put you, but yeah, come on first. I'm tired now for pull say network. Because it's like say now it became magnet for them. It became magnet as they say so they say I'll break this bow. Even though you get documents where they should say okay the car is you get a temporary tag. All then the question at the Sierra network. Like I said, I don't get anything for offer, but the love where I get for and they can me go there. Because even the basic amenities, they talk about are just the basic needs them. Light, water, good healthcare system. We no get her. The person want to then how they pay back dear one back for go. Then before you go, you get for put so many things in place because you know one for reach day you begin catch it. As for me, before I go, a lot of things then they put in place. Because I go because of love. I don't want to go because of hate. Or I go get hatred for the country day. Just like we Dr. Isa to say no one talk about that. To the time we then go broke me small pan body and thief waiting and get for thief. Now if I don't determine me, I get a lot of my friends that say, yeah, and you like salon. Well now they don't do that. Salon not to better country. That's what people tell me. But I not look to that. I not look to that. I do what me get for do. And I'm still going. I'm still going. But until they know the politicians them, just because in Kisu they won't go December, April cow, they won't go until they know say now love na in the care we go there. Love for family, love for the country, love for now the love na in the care we. Until then politicians they know that, until they go begin for away I say, they look the aware oh. But we will prove them wrong. But any kind of way they do, they want to do for make we puelat, we lose hope not for go salon. Not lie, they lie. And the more they go safe. And the more they go. I don't say then go do and say who now they go sit down in now say well, let all can change the change. Let all can put the light, let all can put the water. Because it look like if I say, Michael Cooker, no, I was not at home. Maybe don't travel, come out. I be don't come out. Ah, tribule bin dede. Ah, I got no make grande happen safe. Ah, I worked for mine. I got people and they tell me under snow, under sun, I work for me own. For make person me I did say they can't take. Hey, I get stand your ground no. Texas. I did it for 8 years. So, we'll be back tomorrow for talk about the accomplishments of 2020 with this administration and the thing they will need for remind them. But if they feel to say, then they do all this for make we not go salon, they prove them wrong. Till we'll meet again tomorrow. Triple say, tata.